Good morning, brothers and sisters of the MSMT. I'm David Stevens. I've been a longtime member of the Oklahoma Annual Conference and am under special appointment from Bishop Hayes of Oklahoma and Bishop Rojas of Bolivia to serve as the mission interpreter of the Bolivia-Oklahoma Methodist IU, or the Methodist Partnership. This partnership has been together for 24 years and is the primary missional emphasis of the Oklahoma Annual Conference. The Evangelical Methodist Church, or IEMB, is in need of emergency funding of $25,000 to pay for the salaries of 9 nurses and 1 doctor who serve in Methodist health clinics throughout Bolivia. The church here builds these medical clinics out beyond the reach of the government, where the government is not able to get to, doesn't have the money to get to. Oftentimes these are literally at the end of the road. Local churches make requests for clinics to their district. The district votes on it and passes it on to the General Assembly, or what we would call the Annual Conference. And then it has to be voted on and approved there. They are always built in communities where there's a Methodist church, and usually near the Methodist church. So everyone in the community knows this is a Methodist project. But they serve everyone in the community, not just the Methodists. And also usually always the surrounding communities, which numbers between 3 and 8 depending upon the location. These clinics and these nurses are usually the only medical personnel available to the people in those communities without having to walk 3 to 5 hours to get medical care. If these clinics close, the reality is that people will die. The elderly, those who are in accidents, women, particularly those who are going through childbirth, and mostly children, without vaccines, without emergency care, without prenatal vitamins, and without help through childbirth. The nurse's take-home salary runs between $217 a month and $311 a month, based on seniority. With the government-required benefits and taxes, which amounts to 16% in addition, and the addition of a doctor for administrative purposes that we have to have, their total need is about $2,540 a month. Now, for 20 years, the Evangelical Methodist Church has been in partnership with Andean Rural Health. Andean Rural Health is does similar kind of work as what we're doing, only in different parts of Bolivia. Because of Andean Rural Health's Methodist roots, the two partnered together to gain support and to raise money through a general advance special of GBGM called the Andean Rural Health. This money then was split about evenly between Andean Rural Health and the church. And the church's split adequately covered the cost of the nurses' salaries for over 20 years. But something happened in Andean Rural Health 4 or 5 years ago. I'm not totally clear what it is. I've asked a couple of times to find out what happened, but something happened that caused a dramatic drop in donations through the general advance for Andean Rural Health, which of course had a huge impact on the Methodist, the IEMB nurses. The church tried to fill the gap with their own general funding until things got better. But the reality is that giving is still very poor through Andean Rural Health at general advance. They only get about $6,000 to $7,000 a year, so that only provides about $3,000 to the church. Now, I've also raised some funds through direct appeals to Oklahoma Methodist, but that's only raised a few $1,000s more. So the church has fallen behind in paying these nurses over the last year. Currently, they're behind by 3 months, February, March, and April. they will also need help to finish out the year. My first concern when I found out about this about 6 weeks ago, my first concern was to help the IEMB develop a long-term, sustainable solution to the financial problem. We met with the Helicata. The Helicata is kind of my organizing committee in Oklahoma. It's 9 people who have been to Bolivia at least 5 times and who helped me plan things. And then also I worked with the Bolivia-Oklahoma Medical Commission. These are medical doctors who've been to Bolivia who meet with the medical leadership of the IEMB. Together we have come up with I think a pretty good plan. We're pretty certain that the government will support the salaries of the nurses in the 5 medical clinics that are far beyond the reach of the government clinics. It's also likely that we're going to close one other of the clinics, which is located in a place that has served really, really well and was obviously desperately needed, so much so that the government has built a large hospital a block away. And so we don't need that clinic anymore, so we're going to close that one. And the possibility really does look almost certain. But because of bureaucracy in the government, it's going to take at least a year to 18 months to get this done. But that's going to provide a good 2/3 of our income somewhere in the next year to 18 months. But this still also leaves 2 additional clinics and the administration of a nurse and a doctor that we need in La Paz. So our second sustainable source of income that we've decided to work on comes from the medical volunteers and mission teams. Oklahoma is sending 2 teams in 2012 and 3 to 5 teams in 2013. Skip Hodges is the General Board of Global Ministries missionary here in Bolivia. And he is setting a goal to have 1 medical team from Oklahoma or somewhere else in the United Methodist Church to be in each clinic by 2013. And by 2015 to have 2 teams in each clinic. We are going to challenge each one of these medical teams while they're still here in Bolivia, while the emotion is still going and the connection with the church is still strong. We're going to challenge them to raise enough money as soon as they get back to be the equivalent of the salary of the nurse where they had just served. They will have that nurse's image and hard work in their mind, and hopefully they will go back and raise that. We're confident that the support is going to grow over the next 2 years from this kind of funding. And certainly by the beginning of 2014 or the end of 2013, we think that the salaries are going to be self-sufficient from the money raised by the VIM teams when they get home and by the government support. The problem is we've got to get through the next 18 months. A grant of $25,000 from MSMT would allow us to completely cover 2012 and give us a start for 2013. We've also made a grant request to UMCOR for a one-time grant of $20,000. UMCOR was very supportive, and I talked with the executive director of UMCOR for about 15 minutes when she was in Tulsa. And she was very supportive of this idea, but she also told me that they had already spent all the money for 2012, but she thought there'd be a very good chance for 2013. And there was a chance she could find money somewhere else in 2012. If we would get both a $25,000 grant from MSMT and a $20,000 grant from UMCOR, we're there. We got it for the next 2 years, we're done, we're in great shape. But even if we only get the MSMT grant of $25,000, it gets us through 2012 and the start of 2013. And depending upon how the timing of the government support and how quickly we build support with the VIM teams, we still might be okay with just a one-time grant. I'm not going to come back and ask for a second there's our request. It's a one-time grant for $25,000 from MSMT. If you'd like to see and learn more about the work of these clinics and what I call the ministry at the end of the road, look at the website, at the YouTube website that I have listed below. It will tell you about the newest clinic in Copiague, where Stillwater came from just a couple of weeks ago, and the incredible work that's there and how remote it is. You can also go to the Bolivian Medical Clinics playlist that's also listed here, which can tell you more about the work of the nurses and of the clinics. I asked Laura Yana, who works in Kanani, a question. At first I asked her, how are you eating? How are you getting by? You haven't been paid in 3 months. And she said, well, Pastor, she says, I borrow money from my family, and the community gives me food because they know I'm not being paid. And I said, why do you still work? You haven't been paid for 3 months. We've been behind paying you for almost a year. Why are you still working? She looked at me with kind of an incredulous look and said, Pastor, she said, I'm trained to help people. These people need me. If I'm not here, they will die. Another nurse told me, her name was Claudina Hilari. She said, I had decided to quit. We weren't being paid, I decided to quit. And as soon as I finished making that decision, there was a knock. Someone came into my clinic and said was in desperate need of some medicine. And I had it. And I gave it to him. And I realized how important I was to that community. I decided not to quit. I'm trusting that the church will find a way to pay us, and I'll be able to feed my family. I know this sounds like emotional blackmail, but the actual reality of the situation is this. You are about to make a life and death decision for people here in Bolivia. It's not about possibly closing the doors of some institution somewhere. It's about whether 15,000 people are going to have access to Western-style health care of any kind. It's about whether these people are going to live or die. It sounds severe. That's the reality. Thank you. And if you have any questions, you can always call me. Thanks.